Thanks for being here. I wore a Rotary mask today because James Yonay, the president of the Rotary Club of Syracuse, wanted me to do that to promote World Immunization Week this week, April 24th to the 30th. Obviously very timely for COVID-19, but also for polio around the world. So, James, thank you for that, and thank you for the mask. Let's go over some data, touch on some points, and then we'll take some questions. Dr. Gupta is here as well to talk about any questions related to the Johnson & Johnson vaccine. We're catching up on data from over the weekend. One death over the weekend, unfortunately, Caucasian female, 86 years of age. Certainly a reminder the virus is still here, it's still deadly, and certainly my thoughts and all of our thoughts and prayers go out to the family members and to everyone we've lost in the pandemic. 7-day rolling average staying strong, 1.4 to 1.5. Looking for some real testing numbers to get back for the last 24 hours, but it looks like we're closer to 1.4 than 1.5. Over the weekend, we had 203 total cases. And so Saturday, Sunday, coming into Monday, we'll count that. 67 cases per day. So that I actually reported out on weekends. We get the cases. We transfer out cases over the course of the weekend. We get updated numbers. So I actually reported out over 20 more cases than we actually had Saturday and Sunday. So that's good news. So negative 20 from what I already reported out. Today's number is 44 new cases, and again, 67 3-day average. So it looks like we're starting to trickle back down a little bit from where we were, and hopefully that will be a trend moving forward. A couple interesting points out of the cases today. 0 cases over 70 years of age, so that's very good. 93% of our cases were under 59 years of age. But I do want to kind of just touch on a number that I think we're going to see more of, 41%. Now, 41% of 44 isn't the largest number, but I do think this will be the new trend, is 41% of the cases are 0 to 19. The virus is going to find a host. They're going to find hosts that aren't vaccinated, and so it's going to move to the kids. And your 12 to 18-year-old kids are social, they're active, and if they find a pocket of the virus, it will get to them and it will spread. I just think it's important that we recognize this as parents. There's a lot of parents that reach out to me related to sports testing, wanting me to get rid of sports testing for high-risk sports. And certainly we evaluate the data, and we don't want to do anything that is prohibitive. But the reality is the virus is in these pockets every day. And so if our number one goal in county government related to schools is to keep people in-person learning, number one. If you have an outbreak on a team, on school campus, and it goes into the classroom, that could derail our number one goal. So I have had people concerned. They don't agree with our decision to continue high-risk testing in sports. It's okay that they don't agree with me, but this is why we're doing it. And again, some of the high-risk sports that we saw more transmission with football is ending. We can reassess that going into the fall, but also we can reassess lacrosse. We'll look at some lacrosse data. But 12 to 15 is the largest, today was the largest age demographic within that 0 to 19. Hopefully we'll be able to vaccinate that demographic sooner. What's interesting is you always had the 16 to 19 was always the biggest demographic under 19. We've been vaccinating a little bit now in this, and we're going to continue to vaccinate with parental consent when necessary. But now we're starting to see that demographic improve with COVID. So the vaccine continues to work in each demographic we see. Looking at active cases, 612, so down to 612. Hospitalizations, 43 individuals are hospitalized, so that number got as high as into the 60s. Now it's dropped back down into the 40s. It's been there for about 4 or 5 days. Good news with nine neighbors in the ICU. That number's dropped a little bit. but please keep these 9 individuals in your thoughts and prayers. Looking at the vaccine this week, it's a big week for us with getting out to the schools, the high schools. We will have a first dose Pfizer clinic on Friday at the On Center. Tomorrow, we will be at Fayetteville Manlius High School and Cicero North Syracuse High School. Wednesday, we will be at Jamesville DeWitt High School. And to give you the idea of what we're doing here, we'll have CBA, Manlius Pebble Hill, and Bishop Grimes work through that clinic. On Wednesday, we will be at ITC, right down the street. And Corcoran, PSLA at Fowler, Nottingham, and Henniger will also work through that clinic. Then on Thursday, we will be at West Genesee High School, where West Hill, Solvay, Bishop Ludden, Syracuse Academy of Science, and the OnTech Charter School will go and get vaccinated there. And then also on Thursday, we will be at Marcellus High School, of which Skinny Atlas and Jordan Elbridge will go and utilize that clinic as well. So our goal here is to really get to those numbers. Overall, we vaccinated over 50% of our population, a little bit over that, about almost 65% of our eligible population. It's certainly getting more difficult, and that's why Dr. Gupta and her team are going to be hitting the road. They're going to be doing road shows. And our first one will be Friday. We will be doing a Johnson & Johnson single-dose clinic at the Fabius Area Community Center. We're looking at zip code data where participation is not that great. It makes sense if you think about just geographically where Fabius is. It's probably from downtown, the furthest away out of any of our towns. Not a great route to the fairgrounds, other mass vac sites. So we're going to go into Fabius on Friday with the Johnson & Johnson shot. One shot. Dr. Gupta will talk in a minute about any questions related to what the CDC and the FDA were looking at. But we're excited. Probably next week this will be more of what we're looking at. Dr. Gupta and her team still need to do second doses here from some large clinics. But we'll probably be doing the pop-up model throughout the county. Reminder on testing, asymptomatic testing, on center 4 days a week. You can register ongov.net. Community sites, Tuesday we will be at the Northeast Community Center and Onondaga Town Hall, and Thursday we will be at East Syracuse Village Hall. Happy to announce a partnership with the Syracuse Mets. We will be, May 4th is opening day. To remind the public, we will be certainly showcasing the new $25 million renovated stadium. I highly suggest that you get out and see a game. It's not just about baseball with this. There's about 6 or 7 interesting things that you can do at the stadium to enjoy the weather, enjoy the game, the experience. And it's really, really nice. It's a gorgeous stadium, so please come out and see it. But starting Tuesday, home games, we're going to be doing testing at the ballpark, so that's part of the state's guidance is vaccination or testing. We'll be doing testing 1 to 7 on opening day. Reminder, the first pitch is at 5, so probably want to get there and pre-register before then. You can pre-register at ongov.net for Tuesday for testing, and then we will work with the Mets on their home schedule and continue to do testing there. Happy for that. And before I bring up Dr. Gupta to talk about J&J, I just wanted to recognize a loss the community had over the weekend. Syracuse Teachers Association President Bill Scott passed away. Bill and I got to know each other better during the pandemic as we had to work through a lot of complicated issues. He was a fierce advocate for his members. He was a great family man, and I had a lot of respect for Bill. And it's a tremendous loss to the community. So please keep Bill in your prayers and his family. but also all of his colleagues, who I know were very close to Bill. Saying that, I'll ask Dr. Gupta to come up and talk about the J&J, what happened and transpired with the CDC, FDA, why we got the green light to go again, and then we'll take questions.
Good afternoon, everyone. I'm going to talk just quickly about, before I go into the vaccine, about the quarantine in the schools, which has been quite a bit of a, many questions we get from the sports quarantine. When we look at the quarantine data in we are not quarantining that many people because of the schools' very aggressive approach in keeping and following all the public health guidelines and really doing a great job. But we really need to quarantine if we do believe there was a real good possible exposure in any sports. So we look at the data, we look all the information provided by the coaches, provided by the school administrator, interview with the student, the parent, and then we provide the quarantine to sometimes to limited number of people, sometimes to entire team, sometimes to the both side of team if they were a more of a competition. We also do not quarantine the entire school because of the pretty much almost very no documented transmission of virus within the classroom. As you know, all of them have implemented 3 feet. Many of the schools have implemented distance reduction from 6 feet to 3 feet if they don't have enough space. And despite all, we look at the data, we inform the administrator and the parents accordingly. So I just want to assure those parents who believe sometimes that my kid has been quarantined, why did you do that? Because that was the right thing to do. We're not just doing a blanket quarantine approval for the kids. So I just wanted to bring it out here. And now regarding the second part is, as County Executive has mentioned, is that we were very excited to see that CDC and FDA were able to release the pause from the Johnson & Johnson vaccine, which is called Janssen. Spelling is kind of a little bit weird, but that is Johnson & Johnson vaccine. And we also did our local press release here to reassure our community that it is a good vaccine. As you all know, initially there were 6 cases of a very specific syndrome were noted in females between 18 years of age and 48 years of age, in which their large vessels supplying the brain or the abdomen or the leg had thrombosis, and along with they had the low platelet count. That is actually defined as a syndrome. Since then, when they paused, the CDC gets a lot of information from the VAERS. I think if you have come to our vaccine clinic or to the state, you're very familiar with that name, VARES. It's a Vaccine Adverse Event Reporting System. They get those information from the healthcare providers. We actually fill it out even for the side effects, different things if we have. But usually major things are the ones which are their focus. So they looked at that information. After getting those info, they contacted the healthcare providers, specifically looking for these individuals, interviewed them, and then came out with a pause to review more detailed information. In last so many days before they lifted the pause, they looked many more, and as you may have seen, the CDC was able to find 15 cases between 18 and 59 years of age, all females who unfortunately had these unexpected events post-vaccination from up to the 15 days duration. So lifting the pause is very crucial because when we are talking about we have 50% of population is vaccinated at this point in our community. There are many reasons people have not to get the vaccine, whether it's a vaccine hesitancy because they are afraid of side effects, because they have some not so great information. But one of those things is people don't want two dosage. As we continue to learn, there are people missing second dosage throughout the country, and it provides an opportunity for individuals to have one dose vaccine and get it over with. It is a good vaccine. It is efficacy-wise, as well as if you look into the reduction in hospitalization and death, it's 100% equal to Moderna and Pfizer, who have more efficacy than that. That is true. That's a fact. But in terms of preventing hospitalization and preventing death, it's 100% equally effective. So I would encourage everybody to really think through. You have choices to what you can get vaccine. If many of seniors, I know that I have heard anecdotally that some people would not want two doses, they just want this single dose vaccine, and I would encourage them to look at the information. They can find a lot of detailed information if people are interested in CDC and FDA sites, and enroll into our clinics and get the vaccine. We want to hear from people. We can do a large vaccination clinic if there is enough interest, but right now we are just going to the community where we are looking at County Executive was mentioning, is that we are looking at the data where people have not been able to come to us. We were going there, and we will be vaccinating them. So, and I'll be happy to answer any questions. Thank you.
On a side note, this morning when I got Andrew McMahon dressed, he came upstairs after I got him dressed, and he told me he felt like it was a Dr. Gupta day, and he was dressed up like Dr. Gupta. So I thought it was appropriate Dr. Gupta comes to the press conference today. Questions?
So with these pop-up sites, especially the one on Friday, those will all be Johnson & Johnson, just one-time doses, right? Okay.
Yeah. So again, based off of supply in hand and whatnot, and I think right now I think we have supply of all three. How it works is Dr. Gupta and her team will work looking at the week ahead. She'll discuss with our team our strategic priorities, and we look at the data, and then we make decisions. So this week was kind of always going to be our big high school week, and then we'll plug in the gaps when we have time where we can. But certainly we'll have a pretty active week next week, getting out into various spots of the community. City of Syracuse, probably some more rural communities.
And then, just speaking of people being possibly concerned with vaccine rollout, are you and Dr. Gupta planning on doing anything to just instill confidence in the community about the Johnson & Johnson so that this process doesn't get slowed down?
Yeah, we've talked about different things. We've talked about even maybe doing some telephone town hall, in-person things to address it. I think what we want to see, though, is we're going back out, right? So everybody here will report that this is going to happen. We'll have a registration process. We'll probably go into Fabius, do a reverse 911 call, let them know what we're going to do, and then see what the demand looks like. And I think the demand's going to be okay for the Johnson & Johnson, to be honest with you. Certainly, everybody should listen to the doctors, and there's three choices in the community, and my understanding, Doctor, is that Johnson & Johnson's males have not had an issue with it at all. Yeah. So, so it's a good tool. It's a good tool to have in the toolbox.
And then just speaking of, instilling confidence in the community, there's a question for both you and Dr. Gupta, being leaders in the community, would you, say that you would personally feel comfortable getting the Johnson & Johnson vaccine and your family as well? Yeah,
so I got the Pfizer vaccine. I would take the Johnson & Johnson if I think that week I received my vaccine. Might have been the first week it was available, and so I would have no problem taking the Johnson & Johnson vaccine. Yeah.
So one of the reasons to pause, I think, was just to look at the data, and also because this syndrome is so unique. Usually when there is a blood clotting, the blood is thick, and then it's thrombosing, it's clogging your arteries. It means if it goes to the brain, sinuses, and it's clogging, people can have a stroke. If it goes to abdomen, you could have damage to the whole intestine. If it goes to the leg, loss of limb. The treatment uniquely is a blood thinner, which is called heparin. In this situation, because it's an autoimmune phenomena, that's not the case. And if the physicians know this is the case and they take the history, even for the females, if they are willing, and many women I saw over the weekend were actually very willing to take, Johnson & Johnson single-dose vaccine, having that awareness with them and watch for the symptoms. If you have severe headache, if you have abdominal pain, if you have a leg pain, if something doesn't feel right, seek care. Don't call the vaccination clinic, go to the ER, call your doctor, because there they can do assessment. And also a very important part of this equation is getting the blood, like hematologists, that the doctors who are specializes in blood specialty, are the one who become key partner in making sure that right treatment is being given to these individuals. So these are treatable illnesses if it does happen. So early diagnosis can really prevent future problem in which these situation they got treated with a heparin and unfortunately it bleeds because your platelets are so low. If you have less platelets, if you get a little cut, you will bleed like crazy, right? So in this situation, there's an autoimmune phenomena which is creating a problem with the less platelet count, and you're giving a blood thinner, the person can bleed to death. So if the right treatment, so there are different kind of remedies, you give steroids, you give immunoglobulin, you get different sort of agent which are focused into the place where they can impact the clotting, but without impacting the platelets and without creating that much of a bleeding. And when you were asked that, would I take it? Yes, I would. If I would have not taken, I got Moderna. That's the beginning. That's what we were getting, Moderna and Pfizer, whatever we had in the clinic. And Johnson & Johnson, I would recommend to my family. I would recommend to my friends. I will recommend to anybody who should be getting the vaccine. People should be assured by the data. And I think one of those things about the pause is one should have such a strong confidence that in United States, we have these federal agency who look at the data. If you're putting some information from the VAERS, somebody's checking them. It means that if there are problems, they are going to continue to come back and will say that, okay, there's a problem here, let's pause and let's try to assess. So if anything, this should give more confidence to the people in the system, not less.
How many, for the other two vaccines, how many people have missed their second dose?
Estimate?
Kind of hard to. We usually may have maybe 5%, 10%, somewhere in that range.
Does that seem like they're trying to avoid side effects, or they're just forgetting, or?
Yeah, so we hear that side effects sometimes if they have some body ache, if they have some other side effect, which and they will call their doctor. I personally listened to some of those people when we went to some community clinics or even in the on-center in different places. That some, unfortunately, they get the wrong advice that, oh, you don't get second vaccine. So we actually do quite a bit of outreach to them. If they miss their vaccine on the day off, they continue to trickle in other vaccine days. So we have several second dose vaccines, including in the pop-up clinic. So we welcome people. We just want a notification for them. So overall, I have to look and then give you exact data. But in general, we have some no-shows, about 5% or so in a kind of daily basis when we have the second dosage. And they trickle down and come to some other places at times. And we actually vaccinate out-of-state second doser. That has been quite a bit of things. We are vaccinating from some people who have gotten some vaccines from some other pharmacy. They didn't have it. Walgreens was one of the example. Sometimes, people just didn't want to go. We try to be flexible because these are community members. We don't want them not to get the vaccine. So we work it out and then make sure that they are getting their second dose. Okay.
Ron, is the participation with high school students getting the vaccine what you had hoped it would be? Greater than expected, less than expected?
Yeah, it's tough to tell because some of the parents right away may have taken them to get Pfizer out at the fairgrounds or whatnot. So we're just happy that they're getting vaccinated, right? I think it was, it's kind of neat to see these numbers when you track them for 14, 15 months, and now you're looking at the vaccination numbers and compared to, the percentages of vaccinating that demo, and now 70 to 100 years of age, no cases, right? That's pretty great. So hopefully people are just getting it, that it's working, and that this virus is going to look for a host, and it's easier to get somebody who hasn't had the shot. So that's where we're seeing it, and it's going to, obviously get younger and younger until we can vaccinate in those demographics. So, but it'll be interesting to see the multiple school locations to see what kind of participation we get. Usually at a larger school you get about 150 students, maybe a little bit less, maybe a little bit more, and then you'll get some faculty that maybe didn't get vaccinated, or I think we've had mom or dad or grandma or grandpa show up and we give them the shot too. But it's good. We're getting it through. We're bringing it to them, accessible. A lot of parents want their kids to get active. Mental health's been a real challenge. We've acknowledged that. That's why we've done things and turned on the faucet on different things like sports back when cases were still pretty high, but we had enough data from all of our testing we did. We never would have been able to go from 6 feet to 3 feet like we did, or done sports that early, if we didn't have 15, 20, 25, 30,000 samples of what happens in the classroom with this virus. And so that's why we got this blueprint that's worked. We need to keep doing that. But again, now we've been doing the testing. Now we see what the vaccination is doing to the cases. Let's just get vaccinated.
When were you made aware of this morning's announcement at the fairgrounds and your overall reaction to it?
Yeah, so I spoke to members of the executive chamber yesterday. I knew that the governor was going to be in town, had an idea what he was going to talk about. Pleased with the announcement. I think Dr. Gottlieb, who is a pretty strong professional, that I like talking to Dr. Gupta about COVID, and then I read about what Dr. Gottlieb says. But he had a nice editorial about, as we continue to see transmission decrease, some of the regulations need to decrease as well. And so certainly logistically to have a fair, you need to start getting contracts signed and start moving on that. And so I'm happy to see that. I think it was something that we could pull off. I think we'll know, I'm not sure what the governor referenced as far as capacity. I think that's going to be a moving target based off transmission levels.
We assume the guidance and the future for the amphitheater concerts this summer are along those same lines?
Yeah, so there's guidance out there right now, but really there's a heavy anticipation that that's going to change based off of the effectiveness of the vaccine in the community, and as the community continues to build up herd immunity. And so right now, I don't, Josh, some of these rules are so changing on a weekly basis now. I don't know if it's 25, 33% attendance. I can tell you everyone expects it to be much higher than that, or else it will be very difficult to have a season at the amphitheater. But we have had Dave Matthews Band is confirmed in August. I think what was it, Stapleton, Luke Bryan, some pretty great acts are going to be here this summer. And I think once there's a little bit more clarity, my understanding is some of these other northeastern states are going to move forward with different types of reopenings. Once the marketplace has more clarity, I think we'll see more acts coming into the market, and then more opportunities for more shows.
As the virus moves into younger age groups, are you seeing younger age groups in the hospital too? Are those numbers?
I'll let Dr. Gupta answer that question. But on that point, though, Tim, we're still asymptomatic testing in the schools, and we're not seeing transmission in the schools still on that. But Dr. Gupta, what do you?
So we actually haven't seen much more large influx of data from hospitalization in pediatric population. We do report to you by the age at times, so we haven't seen actually. I checked a few days ago even, because there were some question that there's increased rates of hospitalization in Onondaga County, which is not factual. We actually did the fact check on that. So we haven't seen anything.
But you're not seeing younger patients in the hospital?
No.
There's been some reports nationally that...
No, I know. So I think I know what you're talking about. There was some report came out, and there was some, I don't know, some university, I can't remember which university, some Stanford, I think there was a Stanford professor was doing it, and we couldn't figure it out where this professor was getting data from, because we actually went back and asked the Galisano and tried to check it out, make sure that we get hospitalization report every single day from each hospitals. So I have no idea where they got that information, which is not accurate, and we stick to our local accurate information, which comes from the hospitals directly, and that's what we provided. So the concern, I think, is which you are saying, that if we have younger and younger age get vaccinated, right now we are focusing on 16 and 17, 16 and over. Then if the FDA approves with the 12 and 15, that actually will open up more door. You're talking middle schoolers who are more mobile. The younger one, the one which is in elementary schools, are the one who have the least. Right now there are trials are happening, but there is no approved vaccine for that. But I don't think I would be that much worried about that population, because they have not been shown, we have not seen that many cases in there. Most of the time they are attached to their parents. You know, it's like you're, as county executive mentioned, that Andrew just moves around with the parent. That's what all the kids do. I remember as a young mother, that my kids will be wherever I would go. So I think if the parents are vaccinated, the grandparents are vaccinated, their older siblings are vaccinated, that creates a very good opportunity for us to create a wall against this virus. And those kids are so good in wearing masks that I mean, it's unbelievable how good they are. They're better than adults, actually. So I think we can trust that it should work. And when the vaccine comes, I do believe the same parents who are willing to vaccinate their the 12 to 12 onwards kids will be, again, willing to vaccinate their younger kids. So that's what we are hoping for.
On the hospitalization point, Tim, though, I don't know if this is where you're going. I think the assumption is that even though cases are going to move into the younger demographic, that the hospital number will continue to decrease because that younger demographic just has handled the virus better than the older demographics. Other questions?
Have you talked to the sheriff about the body cameras?
So our team started working today related to body cameras. The sheriff reached out to me. He sent me a letter about another one of my priorities, which is one of his, which is getting the Sheriff's Department accredited. And he brought up some things that are kind of that he believes we'll need to address potentially in the budget to make that happen. So those dialogues are happening, and you know, we're excited about getting the body camera program implemented in 2021 and moving forward with accreditation. Accreditation is so important that on this issue because this is giving these our deputies the best training and tools available, and then being recognized that they do that by independent agencies, right? And so that will keep our deputies safe. It will help make our community safer. So the Sheriff's Department and our administration will work very closely on that, and that will be a goal of both of ours.
Do you have a more refined idea of the cost?
So I think some of the numbers that were being thrown around last week, Tim, like $2 million, I think that's like a 5-year period of time. Usually we're learning more today about the procurement. Usually you don't just get a body camera for a certain period of time with the technology. It's like a 5-year period of time. So we'll have that ironed out this week, and then we'll have the fund balance resolution in the legislature appropriately before their May first session in May.
Ryan, since we got started, news has come out that New York State will lose one congressional seat. It looks like it'll do so by about 89 people, meaning if 89 more people had signed up for the census, they wouldn't have lost the seat. Any reaction to that? Any impact that has on that?
So geez, that's a body blow right there. I thought we were going to lose one. I think the question was, were we going to lose two? So it sounds like we did better than we thought maybe, but we could have maybe avoided a lot of problems. Look, you can look at it from the census way, or you can look at the fact that bad policy drives people out of the state too. So certainly I think over the last 10 years, I don't think there's been a lot of, there hasn't been population growth. So I think people at all levels of government need to understand that you need to look at the policies in many different ways, not just from advocacy standpoint, but what are the long-term implications of this policy? Is this going to help make us more competitive for people to want to live, work, and play in your own local community in your state? So I think losing one's actually pretty good news, but if what you're saying is accurate, I haven't seen this report that we could have saved it by 89 people.
89 people.
That's pretty bad. That's, yeah.